Happy Monday. Happy Columbus Day for those of you who celebrate it. I'm Dr. Karen Leong as part of Face and Body, and we're doing another Monday segment of our Facebook Live. Started off last week talking about the Mom Bod 360, and at that point we're kind of talking about changes that happen after pregnancy and ways that we can help you achieve your goals after baby. So this week, again in honor of Breast Cancer Awareness Month, we wanted to talk about breast. So with the MomBod 360, I wanted to split up the body parts by area and then to address each of those areas week by week. And of course, if you have any suggestions or any areas that really concern you or interest you, please comment below or leave us a message on either Instagram or Facebook, and we are going to be more than happy to talk about that. And also, remember, we're trying out different times, so pay attention to our Facebook and Instagram where we post the topics and also the times. I have no assistant today because she's with her grandma, and I'm working today, so usually I'll have baby with me to help me out. Today it's just me. So I wanted to talk about my breast friends. We're all born with two of them, male and female. A little bit different in females because we have lactiferous ducts, which means that we can make milk. So that if we ever bear children and we decide that we want to nourish them from our bodies, we're able to. But of course, when we do that, they kind of wreak havoc on our breast fins, and then they turn into our breast frenemies, maybe. For me personally, I never had much of anything, still don't. But I did notice with breastfeeding that it really changed, kind of like the color of my areola got a lot darker. My nipples are not the same as they used to be. I actually have more breast tissue now, which is kind of exciting, but we'll see what happens once I finally stop feeding her, because it sounds like that's when you really notice what you're ending up with, and most of the time it's more sad than happy. Okay, when we talk about breasts, I know kind of the first thing that people think of when you're like, okay, well, breast and plastic surgery, breast augmentation. Sure, okay. We will talk about augmentation. A lot of women who go through childbirth, especially multiple children and breastfeeding, even without breastfeeding, or if someone's lost a lot of weight, is that they've noticed that their breasts are more ptotic, which means that they hang down and they sit down on the chest wall or on the belly. And when Dr. Park and I evaluate you, we look at a number of variables, and this is regardless of whether you have very little breast tissue, a whole heck of a lot of breast tissue, or anywhere in between. So let me just run you through kind of a typical breast consultation, let's say. So when we come in and we greet you, and go through your history, and then we go through your goals. And then at that point, we have you in your gown, and we ask for you to stand in front of us, in front of the mirror, so that we can look at everything together. I think it's really important that we look at things at the same time. So, okay, I think I'm back. All right, so again, breast consultation, you and I look at your breasts together. They are sisters. They're not twins. There's always an ugly sister or a pretty sister, depending if you're a glass half full or glass half empty type of person. We always take measurements. So we look at how far your nipple has dropped in relation to your breast crease. We look at how much tissue you have below your breast crease and whether or not it sits on your chest, on your stomach. We look at how wide your chest is, and also we look at the slope of your breast to see if there's a lot of volume loss up top. And then depending on those variables and how they build together, we then make a recommendation, and again also based on your personal goals about what we can do. So today I wanted to go through augmentation, lift, augmentation with lift, and then fat transfer. Well, let's start with augmentation. Augmentation is exactly what it says. It means that we are augmenting your natural tissue, one large breast. And that's not necessarily true, as what we're trying to do is restore the footprint of your breast. So here is an implant. This is a gummy bear silicone implant, and you can see that it's round in shape, and from the side, again, it's like a gumdrop. We in America, the majority of us plastic surgeons will place implants underneath the muscle. This lowers your risk of scar contracture around the implant, and it gives you more of a natural appearance up top. So what we do is we place an incision, and that's also a discussion that we have to have, whether you are appropriate for an incision around the nipple, in the breast crease, in the armpit. And then we create a pocket underneath the muscle, lift it up, and place the implant there. So you can see on my chest, if I place an implant about this size, I can expect to see cleavage and also volumization of the breast pocket itself. In the course of our conversation, not only are we talking about what size we're hoping to be, and by size we're talking about a wish picture with a cup size that you would like to be, roughly, and also the cleavage. It doesn't have to be a number. I always try to tell people, don't get stuck on a number, because the number only gets so far. A number on me versus a number on someone who's a foot taller than I am is going to look very different. Okay, so again with implants, here I have 3 implants, and you can see this one sticks up a lot and this one is rather flat and pancakey. This is called projection and profile. Let me show it to you better. Okay, so you can see here I have 3 implants, and they are all about the same volume. But you can see if I look at them from the side, this one is fairly flat, this one is more full, and this one is extra full. Depending on your goals, we can place any of those. For someone like me, who's pretty little, I don't want anything that's too dramatic. I want to look good in my Lululemon bra. So for me, I would probably choose something more moderate, which is the lowest profile. But there are people who really want a dramatic result, and then for those we can choose a more high or extra high profile. Again, wish pictures are really, really helpful when it comes to this, because that can give Dr. Park and me an idea in the OR of what we're trying to achieve. Dr. Park and I also put a lot of emphasis on cleavage. that in essence is augmentation. These days, we can also do augmentation with fat. Obviously, you have to have enough fat in order to do the augmentation. When I do fat augmentations for breasts, typically I need you to be pretty reasonable with your expectations. I never promise more than a cup size in augmentation size with just fat, and I need you to have a good skin envelope, so no stretch marks and pretty good skin elasticity. So is the augmentation / lift. So lifting the breast is when we reposition what has fallen down back on your chest. This can be done without an implant, with an implant, and with or without fat. If we're doing a lift without an implant, we will reposition the breast tissue up here and remove all that heaviness that sits against your chest or your abdomen. However, what we cannot do is give you a good fullness and cleavage up top. In order to achieve that, we have to use an implant, or we have to do a good amount of fat grafting into that upper pole. Scars for breast lift kind of depends on the measurements of your breasts, and Dr. Park and I will talk to you during your consultation about what is the most appropriate. But if you look and do your research, you will normally find either a lollipop type of scar or what we call an inverted T. The lollipop scar will give you a nice conical shape to your breast without taking too much skin from the bottom. But if you have very large pendulous, droopy breasts, then most likely you will need that inverted T so that we can take some of the extra skin from the bottom of your breast to give you, again, that nice round conical shape. The augmentation portion of it is very similar to the breast augmentation, where we create a pocket under the muscle, slide the implant in, and then tighten the breast tissue on top. If we do fat transfer instead of the augmentation, we'll again do the lift portion with the same scars, and then just put the fat usually up on the top here to give you that cleavage point. I know it's a lot of information, and I know that it's kind of overwhelming when I talk at you about this type of topic. We always encourage you to come in for a consultation. Each person is different, and every breast is different. So what you need on one side may not be the same as what you need on the other. It's always best for us to physically see you, for us to talk together, and for us to formulate a plan together. Sometimes plans change, and we understand that, but it's always better if you're here, and that way we can answer all of your questions at that time. I want to give a shout out to our patient care coordinators, Amanda and Des. So we offer concierge service here, which means that they are available to you by text, phone, email, anytime after or even before your consultation. And one of the things I love best about working at this office is that the team of girls who meet you at consultation, see you at pre-op, and the same ones who will go with you through surgery and through recovery. So it's very much like a big family, and we want you to feel completely and utterly comfortable with us. The recovery for breasts is relatively straightforward, but it can take time for the implants to settle, for the scars to heal, for everything to round out and look like the final product. So it's, again, important that you feel really good with us, because you're going to see a fair amount of us. So I think I'm running out of time, but I would love to have questions. So if there are any comments about the segment today, if you feel like I'm giving too much information, you want to break it up some, or if you think there are different aspects that I didn't cover, please let me know, or let us know on our Facebook or Instagram, and we will get back to you stat. Again, it's Breast Cancer Awareness Month. Any breast augmentations that happen during October, a percentage of the proceeds will go towards a charity that supports breast cancer awareness. And again, Remember to think pink and support your friends and family who are going through breast cancer. And also remember that Wednesday is Breast Cancer Reconstruction Awareness Day, and that's us. So check in on Friday for Dr. Park with his Facebook Live, and then come again on Monday to follow up with the next segment on Mom Bod 360. Okay.